Good evening, everyone. Today, here in this audio, we will discuss that how to ask the question in the for the neurology in the history session. In the previous audio, I have discussed that what should be the framework or outline for the history taking session for the practice exam. So this audio is especially for the candidates who are asking me and who were during my mocks. I have seen that they find difficult to find the words or sentences to ask a particular complaint. They're very good in their preparation. Everything is so fine, but it costs their time. So they find it difficult to manage, and that is why some of the skills are left in the taking session. So the for the you can say the scheme for the history we have discussed in the previous audio in much detail. So today in this audio I will try to make it short, right? So it's easier to listen. So for the neurology station, suppose complaint is from the neurology, like patient is having any headache or any difficulty in walking or fit. So in this way, we have to do the associated symptom, this nervous system in detail. And there are, you can say, 12 or 15 questions related to this nervous system, and we will ask these questions in an order, in a descending order from head to toe. So it would be easier to remember and memorize. And these questions uh, will be I have tried to make the small sentences so it would be easier to remember, and these questions will be at your spinal level. By repeatedly doing the practice with the same phrase of the sentence, it will be very helpful for you and it will be time saving. So how we can ask these questions? Suppose the patient is having complaint of vision problem. So we have asked this question. So while doing the whole of the question of the nervous system, we will omit this question. Likewise, if the patient is having problem with the legs or difficulty in walking or balance problem, we will ask all the question of 12 to 15, whatever is the number of question is. The rest of the question we will ask and we will leave that particular question. So it's a simple thing. So if we start from head to toe, so first of all, we will ask the patient that do you have any headache? If patient says yes, then we will ask about the location, onset, character, intensity of the headache, radiation, of the headache, either it's going in your neck or not, any aggravating or relieving factor, right? And if the patient says no, so it means that there is no need to go in detail of that. Next comes the problem with the eye. We'll ask, have you noticed any problem with your eyes, or have you noticed any problem with your vision? And next can be the question, can be that have you noticed any problem with the sense of smell? Okay. So in this way, we are going downwards, head, eyes, and the nose. Then we can ask, you can rearrange your sentences or you can rearrange your question. But if you do like any descending or ascending order, so you will not get anything. The next can be, have you noticed any difficulty in swallowing? Any problem with your speech? And regarding all of the four limbs, upper limb and lower limb, you can ask that, have you noticed any weakness in your arms or legs? Or we can ask, have you noticed any weakness in any part of your body? So regarding whole of the body, for the upper limb, lower limb, there are three questions. First one is, any have you noticed any weakness in any part of the body? Any stiffness in any part of the body? To rule out any pyramidal weakness, okay, or stroke, you can say. We are asking for the rigidity or hypertonia by asking for the stiffness in any part of the body. Next, we will keep the question of, have you noticed any numbness or abnormal sensation in any part of your body? Okay, so we are by asking these questions, three questions, we are basically ruling out the peripheral neuropathy, okay, or any nerve involvement, peripheral sensory neuropathy, motor neuropathy, okay, or any nerve compression. Next, we can ask for, have you noticed any shakiness have you noticed any shakiness in any part of the body? In this way, we are asking for the tremors and as well as for the fits. And then we will ask, have you lost consciousness? Okay. Next question would be, we are coming down. Then we'll ask, have you noticed any problem with control of your bowel work or any problem with control of your water work? So we will not ask two questions in one sentence, we will ask them separately. Never ask two complaints in one question. So it does not put a good impression. Right? So next comes, have you noticed any weakness in your legs? Or have you noticed weakness? We have already asked. We'll ask any difficulty in walking, any problem with your balance, or do you have any balance problem? In this way, we'll ask these questions. Yes. So next come the aura. If we think that we are dealing with the migraine or we are dealing with epilepsy, so we can add the question. In that case, we will add. Otherwise, we can only say question. Okay, so we'll ask, have you noticed any unusual sensations before all this happened? For the syncope, for the fits, and for the migraine, we can ask. Have you noticed any abnormal sensations before you had it started or all this started before you lost your consciousness? Yes, have you noticed any abnormal uh, uh, did you see any abnormal things which others were not seeing? And have you noticed any, you can say, abnormal sensation? We have asked abnormal smells. Have you noticed any abnormal smells? We can ask, or any flashes of light, or to ask for any zigzag light or anything like that. Uh, Basically, we want to rule out the visual and the auditory hallucination. So we will ask these questions: any abnormal sensations, abnormal smells, or any flashes of light or zigzag lines have been noticed? Then this we will ask these questions. So this is all about the questions of the nervous system. The rest of the systems we will discuss in the next topic. So if you have any question or any particular system or complaint you want to discuss, you can ask me and I will try to elaborate. Thank you very much.